right, let's get rolling.
Nice.
All right, how's it going, everybody? I have Dr. Ben Su with us here today, and he is a Palmer West graduate. We're going to learn a little bit about Dr. Ben today. Dr. Ben, what year did you graduate from Palmer?
I graduated in 2019, March, so almost a little over 3 years now.
Nice, okay. And where do you practice?
I practice right now currently in Santa Clara as a sole proprietor. I currently share an office space with two other chiros, also Palmer graduates.
Nice, okay. And how is that, I guess, how does that structure work for you? Like, do you guys share patients, or you have your own patients?
So I'm a sole proprietor, so the other two docs, so they all have their own patients, so we're all separate entities. But we do act as kind of vacation doctors for each other in case one of us are out of town or out sick.
Okay.
Like today at practice, one of the doctors was sick, so I had to cover for them too.
Yeah.
So it's kind of that thing. So it's nice to have especially when you know your patients are being taken care of, when you can't take care of them because something happens all of a sudden.
Okay. So you are, what is it, 3-4 years into practice now at this point?
At 3 years, technically, yeah. Or
Okay.
3 years as of December this coming year. Yeah,
Gotcha.
that's when I got my license, is the December of 2019. Yeah.
All right. Do you have any advice then to, I guess, current Palmer students or any Chiro students that are about to graduate? What do I expect in my first 1 or 2 years of practice?
It depends on what your ultimate goal is. For most of the time, it's the first 2, 3, sometimes even up to 5 years. It can be something similar to like a residency in med school, where you're out and trying to just gather experience of how to treat patients, understand the case management studies and whatnot. And then after that, most people that's when they start to kind of branch out on their own.
Yeah.
Of course, some people already branch out right off the bat after graduating once they got everything all set up.
Right.
So it depends on where you're comfortable at too. For me personally, I went as an associate for the last 2.5 years before I kind of branched out on my own and started my own business essentially.
Yeah.
And it's a big learning curve. So a little bit different than what school's been taught, or a lot more nuanced than what schools have taught. So
Right.
yeah, you'll learn definitely a lot of things along that journey.
Okay. And then do you also work in a corporate setting as well?
Yes, I also work part-time at Apple through their wellness center. Although I'm there as a soft tissue therapist and not really a chiropractor, but I do work in partner with other chiropractors there too.
Okay.
So essentially what I do, my job there is acting sort of like a chiropractic assistant.
Yeah.
And then doing the soft tissue therapy, if I can do a quick assessment and examination and let the chiro know like, hey, something's going on with this patient or so, or if this patient has noticing these symptoms that are not quite normal what we normally see, then kind of bring it up so they can do like a deeper dive into that.
Okay. What are your thoughts about like chiropractic in corporate settings? Do you think there's a lot of opportunity in the future? Like, is that something that's going to grow into? Yeah, chiropractic is going to be involved in a lot of companies moving forward.
Yeah, definitely it's going to be growing for sure. If you look at over the last 10, 15 years, a lot of, especially the big tech companies, they're out now outsourcing like their healthcare to like small little corporate groups that provide these type of services, whether it's chiropractic. There's also PT, even private healthcare now. Like a lot of big companies has their own. Apple has their own, Google has their own now, Facebook has their own, and I'm pretty sure our Meta has their own now. But every single company has their own at this point.
Okay.
You might not see it with the smaller ones right now because of just the insurance issues that might be going on, but you can definitely see that expanding right now. A lot more of those companies are trying to look for partnerships with some of those corporate.
Okay. And I guess if you're like an Apple employee and you have like chiropractic or like a healthcare team on site, is that something your benefits and insurance already covers? You don't have to pay out of pocket for that when you go visit?
It's whatever the insurance plan the company provides too.
Yeah.
So like say I know with Apple a lot of it is with United Healthcare, so patients still will have to pay a copay or so, but it's just co-insurance, copay, whatever it is that they're it's like going through insurance again. It's just within the Apple sphere, so they don't really have to go too much into detail with the outside.
Okay, and it's probably nice to just have that care team on campus already.
Yes.
Yeah.
Yeah. Although it's in demand though, that's why things tend to be booked out like about 2 or 3 weeks in advance.
Oh wow.
Yeah.
Wow. Okay, so it's like super busy then.
Yep.
Yeah, you can't just roll in there whenever.
No, right now, especially because we're still technically in the pandemic, a lot of the policies in place are still patients have to be screened for coming in first, but so they do get a virtual visit before they actually go on into and come in to see us.
Okay.
Yeah.
All right. So what are your goals, or I guess like plans for your own practice? How do you want to grow it? Do you want to practice a certain way? You want to target a certain population?
I think this is something that school and some of my mentors have mentioned, is that you definitely want to find a niche, a population to treat, one that you know it's going to that your unique setting is in,
Yeah.
or some sort of specialty that you have that is different from other chiros, and that makes you stand out a little bit more.
Gotcha.
For me right now in my private practice, I see a lot more first and second generation Mandarin speakers. So a lot of people who are not sure how the whole insurance works, and as well as not exactly, they don't understand what chiropractic is. So I spend most of my time just education about talking about chiropractic to them.
Okay.
Yeah, because if you think about it on a basic level, it's essentially bone setting.
Right.
And a lot of Asian culture already has that as part of their healthcare system, but then the difference is that I tell patients that we're just educated. Yeah. Versus like the traditional bone setters, it's all passed down, or like you see the grandmaster martial artists, they'll know how to set the bone because they just look at it so many times.
Yeah.
So they understand that aspect.
Okay.
Yeah. That's kind of the difference too.
Okay. So kind of like building off that aspect, has there been a chance for like maybe in your position, have you had a chance to incorporate chiropractic into like other forms of medicine that maybe your patient base is more familiar with, like Eastern medicine and chiropractic?
In terms of incorporating, I've kind of have like we have a little network with acupuncturists or so.
Yeah.
And there's some things that are not quite seniorized, or we think it's more not to chiropractic can help, then we'll send them out.
Yeah.
Again, that's something you'll be taught in school. Is like, okay, know what chiropractic can help with and what it can't help with.
Right.
Once you differentiate that, then you know it's like, okay, you've done this conservative trial care and this patient doesn't seem better, it's not getting better, then that's when you would refer out to say someone who specializes in acupuncture or even Western medicine.
Okay.
Because it depends on the patient condition, because every patient responds a little bit differently. I haven't had a single patient who's identical to the same complaint. It's all subtly different.
Okay.
Yeah.
I see. So our last question today, and you kind of alluded to it, when you're explaining chiropractic to your patients, especially who have like they have no idea what chiropractic is, or they're like, we have something like that. It's called bone setting. So how do you like describe what chiropractic is to a patient? How do you explain it to them?
So the difference is that I would say, because we emphasize so much, a lot of the more Eastern influence attributes more to the musculoskeletal system, which is, yes, we do that. But the difference I try to allude to is that we follow the nervous systems. Yeah, usually like the nerve roots, the DRs, and muscle testing, you get an idea of where it's coming from in terms of the spine. And I try to explain like, yes, there is a bone, and there's not just a bone, but muscle, ligament, tendon component to it. But then what it's indirectly affecting is the nervous system too. And so I try to explain that and using visual pictures of the spine, right? So they understand like, oh, brain controls everything. It has to travel through the spine. The spine comes out to the nerve roots go to the rest of the body, right? Okay. If any of that pathway is blocked, you have these type of symptoms that you normally see in a lot of the complaints that we see in terms of musculoskeletal. Okay. So it can be the muscle itself, a tendon. Yes, that's true. But we try to emphasize and connect the dots, saying that this is actually maybe originating from the spine, because a lot of stuff I see is what we call cumulative effect. It's not so much a one time popped out of place and then all of a sudden you're having pain and discomfort. It's like, no, this has been building up to a point where you have something that broke the camel, like the straw that broke the camel's back, right? So that whatever that trigger is, we try to identify what is. Yeah. And then you'll learn this in school, like 90% of the time, just by listening to what the patient says, you get an idea of what caused it. Okay. Usually, it's not, and a lot of times, I find isn't whatever the recent trauma or injury was just a trigger. And you do a deeper dive in the patient's history, and you'll learn like, oh, it's actually they had all this stuff going on in the past, and it was never addressed. Okay. And then we say like, okay, and we start to connect the dots. Yeah. And this is where I feel that is essential for patient care, is explaining just the connection of this past issue to the present one and how it connects, and what it looks like from time in terms of a time frame. Okay,
Okay.
because we know body gets well over time if you give it
Yeah.
enough time, right?
Right. Yeah.
How fast it comes back or how slow it goes back to what we call a healthy state depends on what you do with it.
Right.
Most of the time when we're younger, especially a lot of the Asian cultures, it's like kind of walk it off, right?
Right. Yeah.
It's like
brush it off.
brush
and,
it
like,
off,
It'll
get
get
on.
better soon.
Yeah, I'll get better. Yeah, just leave it alone.
Yeah.
It's like sure, that's true of just about any condition,
Right.
especially when you talk about musculoskeletal, right?
Yeah.
But could it be faster? Oh, for sure.
Yeah.
Could it be some more supportive? Oh, yeah. And then can you get back to doing what you would like to do? Yes, you can. And you can do it at a faster rate.
Yeah.
What I find that chiropractic helps with is that it facilitates communication between the healing process between your mind and the body area that's injured. And then once that's been facilitated, it knows body responds a lot more efficiently, and so recovers a lot faster too.
Okay.
Right. Of course, we have a lot of studies saying like chronic conditions versus acute conditions, and you will learn the nuance about that in school.
Yeah.
But the key thing is try to tie it back to the spinous and nervous system. So that's why, that's why I've been trying to emphasize. It's like we're not just bone and joint; we are nervous system.
Yeah.
We assess the nervous system too.
Okay.
And so, and you'll hear and you know about a little bit of the philosophy where they talk about, oh, it could be the spinal flow, the energy that people talk about. Yeah, possibly. It could be the myofascial flow that people feel. Yeah, possible as well. If you look at the charts of just like those fascial points or fascial flows, it looks very similar to like an Eastern Chi or Meridian chart too. So it's like, okay, there is some correlation there.
Yeah.
Okay. Whether it's direct or indirect, who knows? It's hard. It's kind of hard to measure at this point.
Right. Yeah. And I think like the more important one is like, is your patient getting better?
Yeah.
With what you're doing. Right?
Yeah. Is the patient getting better? Are they getting better faster?
Yeah.
Okay. What is it can you do to facilitate that healing process to allow the patients to return to what they want to do?
Yeah.
Their activities in daily living, whether it's to play a sport or see their grandkids or live with their grandkids, whatever it is, they have to understand that one, healing does take a little bit of time.
Yeah.
But how fast and how short that healing time is what we can manage and address.
Great. Well, it's been great talking to you, Dr. Ben.
Yeah, no
I
problem.
appreciate you taking the time. Let us know where we could find you out there. Do you have a social media page? Anything that we could follow Dr. Ben, see what he does?
Yep.
Cool things that he's up to.
So I do have a website. You can just www.drbensudc.com.
Okay.
Or you can find me on Instagram or Facebook. Just look up my name. I think my Instagram name is at dr.bensu.dc.
Okay. I'll post it on the video as well.
Yeah. Go ahead and do that.
Yeah.
Yeah. I try to post some stuff occasionally, but it's just more for. Then for my social media stuff, it's more for like educational purposes and anything else. Like it's just meant to like, oh, here's this, is this. Okay, there's something you can check out. There's plenty of videos out there already.
Yeah.
It's just like finding the ones that are good quality.
All right, cool. Yeah, I'm sure people will benefit from it.
Yeah.
Either way. All right, appreciate it, man. Thank you.
No problem. Take care.